Yeah.
Good morning.
Oh, well, let's just go with morning.
Oh, it's 7 o'clock here, so this is a morning for me.
Oh no, it's the middle of the night. Uh, oh, Kathy, moving is not very much fun. Did I tell you that?
Oh, I know, and it gets worse as we get older. No offense, not that you're old, older.
Oh, good. Well, then I better not do it again for a while. It's like a million details, right?
Oh, totally, right? It's just everything. It's physical, it's mental, it's oh,
Yeah, like this morning, I'm suddenly trying to figure out how much contents insurance I need, and oh my God, it's like a million little crummy details. There's nothing interesting about it at all.
that's
It's
why
just a thing.
Scotty and I chuckle because we've got our three little trailers all in little spots, right? Except for our condo. And
Yeah.
with the trailers, we always say, oh, when we're done, we just drive them off a cliff.
Well,
Let them go.
it really, there's nothing wrong with that. Oh my
Nope.
goodness gracious, it's crazy stuff. Anyhow, I have a very saintly friend who's been helping me.
Oh, good.
He's going to win a saintliness award.
Oh, I should have come back. Scotty and I are the moving masters.
Oh, don't tell me that now.
Now, well, that's why I told you now. I wasn't going to tell you before.
Yeah, that good point, good strategy. Oh my goodness gracious, good strategy. Um, has someone else joined? Is it just me and Kat?
Hi, it's Kaylee from Ovarian Cancer Canada.
How are you?
I'm well. I'm listening to your moving thing, and I just feel this. I've been doing like taxes, trying to get my kid into summer camp. I'm just so ready for the summer and to get, I don't know, there's something about this time of year that's the worst.
It is the worst.
Yep. There's too much logistical, unfun stuff to do.
Isn't that it? I know. You just have to kind of get a vision of where it's taking you.
Yep.
That's the only thing, right?
Exactly right.
Yeah. You just have to just know that it's kind of a means to an end.
Yeah.
Anyhow, there we are.
Yes.
So, well, by the end of this week, I'm going to feel a little more settled.
Yeah.
Hello, somebody else joined?
Hi, Louise. It's Antonella from CPN.
Hi. And
Good
who else?
morning.
Someone else just joined?
Hi, Wendy's on the line.
Hi, Wendy. How are you?
I'm good. How are you?
I'm fine. You and I are supposed to be having a lunch one of these years, eh?
Yes, we are. Yes, we. Yeah.
Lucky I'm not waiting. I'd be like starving.
I will. We will get that booked.
I know we will. Who else just joined?
Hi, Louise. It's Rose.
Hi, Rose.
How are you?
I'm fine.
Wonderful.
Okay, who else are we? I'm not sure who else we're expecting. I'm sorry, I'm so not very well coordinated. I'm still blaming my move. I don't know how long I can get away, much longer I can get away with that. But I'm going to try at least one more week. I think we're going to start with the people who are on the line. So this call is being divided. Oh, there should be more people coming, Chantel says. That's good to know. But I think we should. I've had a lot of acceptances. Okay, so, but I think really this call is going to be divided up into two parts. The first half hour, if we need it, if we don't need it, that's okay too, is to talk generally about what's going on with the Ontario Super Agency. And then in the second half of the call at 30, we're going to talk specifically about the cancer side of this equation to the extent that we can figure that out. Somebody just joined.
It's Kim. Hi, everyone.
Hi, Kim. How are ya?
I'm doing well. Nice to hear you, Louise.
And you too. Okay, so I'm just gonna start us off with what came out of the last conversation we had. And I know you weren't all on that call, so I'll just do a brief run through of what came out through that conversation, and then a little bit about what we've done and talk about what we're doing. And this is general, not just oncology specific. So on our last call, there was, I think the determination basically that came out of the call was that as a result of the vagueness of the new proposed legislation, we weren't in a position to necessarily complain about anything specific that's being proposed, except with regard to cancer, because it seems to be a kind of different animal than all the other fish that are listed in the proposed organizations that are going to be consolidated. But for the others, there was a recognition, I think, generally that the LHINs, which make up a lot of the groups that are going to be consolidated, and even HQO and eHealth, certainly, no one is suggesting that we couldn't do a better job of coordinating and synergistic healthcare delivery in the province. So I think we all agreed that the principle of trying to do that isn't a bad one by any government, and that as I said, the language of the legislation is so vague that there's nothing necessarily about it that we can say don't do this. However, I think certainly my read of it, and I think most people's read of it that I've read, is that it definitely leaves the door open for the board of directors of this super agency to create public-private partnerships to deliver healthcare, or entirely private ones if they so choose. And of course, I think, as you know, that has been the sort of cry from the NDP for the most part, is that that really what's going on here is an intention to privatize. So, which of course the Minister of Health has not refuted, but she sidesteps it. She sidesteps it by replying, everybody will always be able to use their OHIP card in Ontario to get services, which isn't actually the point. We know that, but the question is, what will those services be? Who will be delivering them? How quickly will they be delivered? And all of those other questions. So she has absolutely sidestepped the main issue that the NDP is raising. Just for you who may not know on the call, the NDP is holding a town hall on Ontario healthcare tomorrow evening in Toronto. If anybody on the call who doesn't already know is interested in attending, it's open. I'm definitely going to attend, and I'll be glad to report back anything I learn, and if something else, if anybody else wants to attend, that'd be great. So that's the first thing, I guess, is we're trying to get the lay of the land. The other thing, but what did come out of our call, I don't know, somebody's got some sort of a big noise in the background. I hope everybody can hear okay. Somebody sounds like they're either breathing very loudly or they've got wind or something in the background. Oh, that's better. So I guess, so what I would say is that what we did conclude was that even though there's not a specific portion of their proposal that we would say don't do that, we were very concerned because there is absolutely no reference anywhere or commitment yet made that there will be patient and patient group engagement, not just engagement, but involvement in the decision-making processes that they're setting up, including the board of directors. So I think that was the biggest message we wanted to deliver, was where are we? And the other message was, before you cook anything, have public consultations. So those have been the two sort of headline messages that we agreed we wanted to deliver to everybody who was in the decision-making process. So what we did was we have written out to all three political parties asking for the opportunity to meet and have discussions about what they're planning. France Gélina has agreed to have a teleconference with us. She hasn't confirmed. There's 2 dates she offered us. I haven't heard which one was accepted, but the 2 dates that came up were March 14th and 15th. If there is anybody on this call who wants to join, because she's coming in by teleconference. If we can, we're going to meet 2 of her staff people in person, and then they're going to teleconference her in. If there's anybody on this call who is interested in joining, could you send me a little note? And once I find out which date and time has been set, I'll be glad to let you know. So she has confirmed, and we have a letter out to the other 2 parties, and hopefully we will be fortunate enough to get a meeting with them shortly. And of course, we'll speak to Andrea Horvath tomorrow night at the town hall. So that's, other than on the specific oncology front, that's what we have, that's as far as we got in our last call. And I'm not sure if any of you have any other, I'm not sure what any of you think ought to be additional next steps. Of course, I'm most interested in any and all suggestions. I'm starting to wonder if a next step shouldn't be a letter to each of our MPs about the MPPs about this. We didn't get that far on the last call, but I'm wondering what people think about that as an additional next step.
Louise, it's Kim. I think it's a great idea, and just from the perspective of our organization, it's a really good time for us right now because we're kind of changing tactics on our access to medicines files. So we have about a 4 to 6 week period in Ontario where we have about 40 or 50 of our volunteer advocates who are looking for something to do. Wow. And we could fan it out to our network, who would fan it out to their network. So I'm thinking, an official letter from our organizational heads, but also perhaps tapping into whatever volunteer power we have to have people send kind of more personal messages.
That's a great idea, Kim. And in fact, if they're really looking for things to do, obviously the very best thing would be if they could get a meeting in the constituency office with their MPPs. And I think that's another to do, I think, and we should all do it ourselves, in fact, those of us in Ontario, should all, I think, and because they have to see you in their constituency office. So I think that's another to-do that we should put on the list of things to do. So the to-do coming out of this first one is, in addition to what we're already doing, draft a letter that people could send to MPPs. I don't know if there's anybody on the call who would be willing to volunteer to do a first draft of a letter that we could, that I'd be happy to sort of review and modify and if necessary and finalize. But I would really appreciate, given my mid-moving circumstances, if somebody would be willing to take a first cut at a draft of that.
Hi, Louise. It's Jamie from CCSN. I just kind of wanted to give a heads up to everybody on the call. Just late last week, there was an email blast from Ontario News. I sent it to everybody as well, so I don't know if anybody's had a chance to look it over, but in that news announcements. There is a ministry's virtual pool of patient advisors that they created. And I know our messaging is about, asking to be consulted. So I want everybody to know and be aware that that in case, when we go into the meeting and propose this messaging, that this will be a response. Other things that they've posted are the Patient and Family Advisory Council, as well as the board members, in which one of them is Shelley Jameson, a former CPAC ED, I believe. I'm not too familiar with her, but I'm sure most of you are, or some of you are. And I think with the patient advisory, there's opportunity to patient advisory to the province and also to your community. I tried to sign up, but it kind of led me to like an error landing page. So I'm not sure if anybody else is actually able to sign up, but just letting everybody be aware that that's a potential response that they will get from the PCs.
Thank you. Actually, I was going to get to that a little later on. And in fact, I did get to sign up for some reason. So
okay.
I was able to sign up, so don't give up. I'm not sure.
Yeah.
Don't give up. And if anybody else is interested, do you have a link to that, Jamie, that you could share with all of us?
Sure.
That would be lovely. Okay. Yes. So who knows? Maybe who knows, right? In any case, but that certainly it's another access point. So let's go back to our MPP letter. Is there anybody who would be willing to take a first crack at a draft? It's pretty simple kind of letter.
Sorry, I was on mute, Louise. It's Kim. I'll take a shot at it.
Thank you very much. So if you once you get it done, if you want to send it to me, I'm happy to take a look and see if I have any suggestions, and then we can get it out far and wide to people who want to use it. I do.
Louise, sorry, it's Wendy. I can help out Kim with that as well if you want to do it together, Kim.
Sure. Yeah. I mean, maybe we can touch base after the call and just see how we want to tackle that. That'd be great.
Sure, that'd be great.
Thank you very much. Then I would suggest, once we get that finalized, is there anybody on the call who, and I'm thinking, Jamie, it might be you, but there could be others, who has a list of the MPPs and their ridings? Because I think if we could send out coordinates with this to people and suggest that they try to set up a meeting with their MPPs, that would also be very useful.
I have that database. I could send it over.
Oh, fantastic. Okay, good. So that's kind of, where we are at the moment. I feel as though, I just so you know, I know it's oncology specific, but it does give you kind of a clue of how this is unraveling or whatever it's doing. I did get in touch with CCO, and they say, and I believe them, that they're not being, some of their senior management probably is having some conversations with the architects of this, but for the most part, and I think this may be true for the LHINs and for everybody, that all these groups that are actually going to be impacted are not being told anything any faster than anybody else. So basically, they're reading it in the newspaper or whoever's reporting whatever at the same time the rest of us are. I'm sort of laughing, but it's terrible. I mean, it's sort of gallows humor, but yeah, so they're not learning anything any faster than anybody else for the most part. Now, it may very well be that they're very, very, very top people are getting something, but I'm getting the impression this is being very closely held and information, and it's not going to be easy to get the details, even from those who are impacted, even by those who are impacted. I wanted to just let you know that. I'm sure the Lynns and everybody else is in the same boat. So is there anything else that people think we should consider? There was one or two of you wrote to me and asked about media, and for what it's worth, everybody of course will do what they think is best for them, but I mean, if the media called and asked something out of the blue, that's one thing. Even then, I think we have to be very cautious about what we say. I think if the media did call anybody, I would say at this point that the message is basically the two messages we've delivered, which is, this may be a very good thing. It may do exactly what we understand they intend, which is a more efficient, synergistic, and it may improve access. There just isn't enough information to know. But the two things we strongly urge are do public consultations before you come to that conclusion. And two, please ensure that patients have a decision-making place at the table of all the decision-making tables that are set up in regard to this. So, and also I was asked, well, should we reach out to media? Because some groups have, in terms of the Lynns, et cetera, et cetera. I'm not recommending that. I mean, probably a lot of you are pretty savvy about media anyways, but just from my experience, and I mean my personal experience, the one time I was kind of pushed to the wall to go to the media about something the provincial government was doing, and in fact it was Tony Clement at the time, before his disgrace. That government was so angry. I got what we needed, but the government was so angry that they never spoke to me about anything again. And they had at least been willing to have meetings with me, et cetera, as required. And they really, like that, to me, that has got to be a last resort, because you really do cut off your relationships with the government at that point. So that's just my advice. I mean, I can't, each of you will do what you think is best, but that would be my recommendation at this point. Stay away from the media, and if they approach you, be very, just give our key messages and don't be critical at this point. I don't think we can be anyways. I don't think we know. But I just wanted to warn you that, that's a real risk. So that's kind of what I know so far. Anybody else? Yes.
Yeah, it's Antonella. Last time we talked about reaching out to some of the big associations in terms of medical professionals to request meetings to let them know what we're thinking and to possibly get them kind of on side in terms of the asks that we do have so far. I'm just wondering, is that still something that you think is something we should be considering, or at this point just go with them?
Oh yeah, I definitely do. Okay. I know that I've reached out to, I reached out to CCO. Well, really, it wasn't those kind of organizations. I know on the oncology side, I can only speak for this, that what we're trying to do is work through our medical/scientific advisory boards to speak to the medical professionals on those boards and get their advice. And I drafted something to send out to the medical professionals on our medical advisory board at SYSF. Would it be helpful to anybody if we shared what we wrote out to them?
Yeah.
Oh yeah, yes, I absolutely think so.
Kath, would you be willing to share that with the group?
I can do. And I've already had responses from our medical advisory board, and they're saying what we're saying. It's still very vague. they're not hearing very much about what's happening on at their level. So they're feeling exactly the same way as we are as advocacy groups. I'll send that out today, Louise.
Oh, that would be great. Thank you. And so that's that's, I think that it's obvious CCO isn't going to talk about anything. So I don't think there's any point in our doing too much more with them, except I was very clear with the person with whom I was communicating that we strongly supported CCO, that we strongly supported the work they do, and that we would certainly, continue to communicate with them if we had any information we thought was helpful for them, and also if they had any and they felt they could share it, to send it along. So that's kind of what they said. I also spoke to CPAC, CPAC, and they're the cancer, they're the federal group that manages the cancer strategy at federal level. She really had also said she had no insider information for me, and that to her knowledge, their group had really not been engaged or asked to be engaged by the government. So I don't know what that kind of means, but I think it means what I said earlier, which is that it's being very closely held information, and it's kind of on as needed to know at the time the government decides you need to know. So the other, I also wrote out to BioCanRx, which is a group of researchers, because I think the research community obviously ought to be concerned about this as well, but I haven't received a response there. What other, other than, not just other than, but researchers for sure, doctors for sure. I don't really have connections with nursing associations, and I don't know if anybody on the call does. It would be certainly great to, hear from them if they have some information they think, they want to share or they're interested in.
Louise, it's Antonella. I do have a contact in policy at RNAO, and I can reach out and just to see if I can get any information from her. That would be helpful.
It's Kim. I believe I still have a contact at the VON.
Oh, excellent.
Mm-hmm. So let me look into that, Louise.
That would be fantastic. And I know that there's a group called the Ontario Health Coalition that has been quoted in the newspapers, and they're very much the unions. At least that's what I can read from the website. It's a lot of union connections. And I was thinking that we might bump into them tomorrow night at this town hall. I'd be shocked if they weren't there. So I was hoping to kind of make a face-to-face connection, and also whoever else, is there tomorrow night that's there for groups, working for groups that want to take a position here. I would be glad to. The one thing, obviously, at least I think is very important for us, is not to become politically aligned, any political party on this. Yeah. So as much as I'm happy to hear what the NDP has to say, I'm happy to work with unions and with all nurses, everybody. I think we need to be careful that we don't allow ourselves to become seen as aligned with this as a political party issue. And they will try to do that, all the parties will. Why wouldn't they? That's kind of how they work, right? So I just would suggest that, but it will be a good place to see who's interested, who's out there, and with whom we might be able to build some coalition. But I won't do it if it's under the auspices of any political party. Mm-hmm. So are there any other kind of stakeholder groups that we can think of that anybody knows and thinks we ought to try to
We talked about the Ontario Hospital Association last time as well.
Yeah, they're very smart. The hospitals are very savvy, and they seem to be very much connected to what the government is doing, which really shouldn't be a surprise given that his czar of health of hallway medicine was the head of hospital. So I don't have any connections there, and I think we should reach out to everybody, but I'm a bit nervous about them because I suspect they will be very much aligning with the government on this.
Mm-hmm.
Anybody have there and think it was useful, I'm happy to.
It's Kim. We've worked with, not in my current role with Cystic Fibrosis Canada, but when I was at the MS Society, we did do some work with the hospital associations, and I will be frank, it was difficult because, of course, they were aligned, as Louise mentioned, and it's, I think much like some of the other groups, stakeholder groups, aligning too closely with them could actually be detrimental to the outcomes that we may want in the long term. So I think, be friendly with all, but be cautious.
Yeah, I think we do have to really watch, as with the unions, they're going to be very NDP focused for the most part. So I think in all cases we, proceed with caution. So if anybody has a connection there and just, wants to just have a chat, mostly listen, not talk too much, then that seems, nothing wrong with it, but I just don't know. And I don't know about the Ontario we were thinking that we would work through our medical advisory boards for the OMA and let it be a peer-to-peer discussion about that. That seems to go a bit better. So I don't know if there's any other stakeholder groups.
I think it's a great start. So even if it occurs to us as we go ahead, we can think about that. But at this point, I think we have a good plan.
I think so. It seems like a good plan to me. If there's nothing else on the general stuff, then those of you, so Chantal will get us notes out from the call and the to-dos, and or Rose, are you taking those notes? I can't remember who's taking them up through this call.
I've been taking notes, Louise, but I can chat with Chantal after to figure out who'll send them out.
Fantastic. Okay, just so people kind of have their to-do list. So if there's nothing more sort of on the general stuff, then I would move to the oncology stuff. And I know some of you won't, that's probably not your area. You're welcome to help us solve that problem too. But at this point, I think I'd switch over to that conversation unless anybody has any last comments on the general stuff.
Thank you so much. And good luck with the oncology.
Thanks, Louise. Kim, do you have my contact info?
Oh, maybe she's gone.
Okay, can you maybe flip that? I'm trying to piece all the people together here.
Yeah. Well, you'll get a copy. The notes will, right, Rose? The notes will have everybody's email.
Okay. Yeah, they will. Yep.
Oh, and sorry, Louise, it's Kath. I'm about to send out that letter that we sent to the docs, and I've got everybody's email on the email line, so you'll have it there too.
Oh, perfect. Okay. Thank you. Bye, guys.
Bye-bye.
Bye. Thank you. Okay, so who's left on the oncology piece, and then maybe some oncology people joining? I'm not sure. I'll just check with Chantal if.
Allison and Jamie from CCSN are still here.
Oh, great.
I'm here. Christina's here.
Oh, fantastic.
And Kaylee Crawford from Ovarian Cancer Canada, I'm here.
Oh, great. And Kath, are you still on the call?
I'm still on.
Okay, great. Anybody else from the cancer gang that hasn't spoken up? Okay. Well, moving to the cancer stuff, in the last call, just as a very brief roundup of the content of the last call, we agreed that there is something very different about the management of a cancer agency relative to the other kinds of general health systems agencies that are going to be consolidated. And that there was a great deal of concern that those skills and knowledge and expertise that one needs they may not recognize that and ensure that those are on the decision-making bodies that are set up under the super agencies, to be sure that those differences are understood and acknowledged, and that there's a way to deal with those. I don't know, I know there's at least one of you wasn't on the call last time. If you think that we drew the wrong conclusion there, please speak now.
Well, I wasn't, this is Kaylee. I wasn't on the call. I'm finding this very interesting. So thank you so much. I wasn't on the call last week, but I'm coming at this from a real beginner place. So I'm not going to be having much critique in terms of where you came with it.
But you know, sometimes fresh eyes are a very useful thing. So please don't let your newness to it stop you from reacting to, anything at all, please. So that's what we concluded. And we concluded that as a result of that, number one, we would try to get meetings with the three political parties. And I know, Christina, you're on now. I know that France had given us 2 dates. Did we nail down a date for our meeting with her?
I heard back from you and Martine, and I wanted to get on this call to hear back and see if CCSN wanted to join as well, or if Kath wanted to join.
Got it. So
back in the office.
CCSN and Kath?
This is Jamie. Jackie's back in the office tomorrow, so I'll see what works with her schedule, and I'll let you know.
We have to, in that case, why don't I go ahead and nail down the Friday and when Louise can be there face to face, because they're holding those dates for us right now. And they and so we can, if we have to switch it later, then let's do that, but at least let's have a confirmed date, because I don't want to lose that before.
I agree. So it's March 15th at what time now, Christina?
Just let me confirm the time.
Thank you.
And Louise, I'll dial in if that's okay. I'd love to dial in.
Yeah, sure. We'll just let Christina's coordinating, so we just make
1 p.m. 1 p.m.
1 p.m. Okay. And you'll send me the coordinates of where we're to be?
Yes.
Okay, great. All right, so we've done that. Christina, you sent me, and I'm not sure who else. Someone just joined?
That's MJ from Rethink Breast Cancer.
Hi, MJ. How are you?
Hello. Good.
We're just talking about the first step that we, following up from our last call on the oncology piece, and we have a meeting set with France Gélina Friday, March 15th. I'm in May already. March 15th. Well, I want to be in May already at 1 p.m. And we did you finalize the letter, Christina, to the Liberals, to the Conservatives?
I sent it all out after Friday.
Oh, fantastic! So we sent a letter out seeking with them, a meeting with them. And how are we doing with the Liberals?
So that one's been sent as well. We just haven't gotten responses back from both of those parties.
All right, great. And
Christine,
sorry.
sorry, Louise, it's Kath. Christine, would it be too much to ask us to for a copy of the letter? Did we get it? Did I miss it? Okay, that'd be great.
No, not at all. I can send it to everyone.
Okay, perfect.
And as I mentioned in the first half of this call, which was just the general stuff for any of you who weren't on it, tomorrow evening at 6:30, Andrea Horvath, the NDP, is holding a town hall on Ontario healthcare, and I'm certainly attending, and if there's anybody else on the call who wants to attend, it's open, and we should definitely see what we can do, and that'll be a place to see where we can develop some other collaborations, appropriate collaborations, and hear what everybody else is kind of thinking. So we might have a little better sense of it, where things are going after that call. But in the meantime, we'll definitely go to that call and report back. So we got those invitations out, and MJ, just as a sort of our byline, is that the Cancer Agency is a very different beast than all the other agencies that they're proposing to consolidate. It has a very discrete mandate, whereas these other agencies are all kind of general health systems agencies. And so the expertise, skills, and knowledge that we require are quite different. And we're very concerned about how they're taking that into account in the creation of the decision-making models, processes under the super agency, including, of course, the super agency board of directors. So that's kind of our messaging. Our messaging is, you know, the cancer care can't be improved, and we're against improving it, but, you know, it is a very different kind of an animal than the others. So that's the first thing. The second thing that came out of the last call, I agreed to contact the Applied Research Committee, which is researchers in Ontario. I agreed to contact CPAC, and I agreed to contact BioCanRx, which is a group of researchers. So I did do all three. And what I learned, the Applied Research Council group, I forgot, honestly. I'd like to say that I actually planned this, but I didn't. I forgot that the woman who is my contact there actually works for CCO. So in a way, I kind of got into CCO through the back door. But what she told me, is that CCO basically doesn't know anything about what's going on. That basically they're kind of getting things in real time, the same as the rest of us, and they don't, she doesn't seem to think they're getting a lot of airtime in terms of how this thing is going to work for cancer. She said that she said maybe a few of the senior people there are, you know, having some private meetings, but if so, nobody else at CCO knows about it. And in general, I think she said they're kind of feeling, you know, just as kind of out of the loop. You know, she said it politically correctly, but, you know, that they're not really knowing more than we know. So I just expressed our support for CCO as a community, and the fact that we would be more than pleased to help them in any way that we can. And she expressed her appreciation for our support, and also indicated that if, you know, she hears anything, she will let us know, and I committed to do the same on our end. So that's what I learned from CCO. I also heard back from CPAC. Again, I was told that really they have no insider information. They have not been directly consulted about this. It's probably not a huge surprise given that they are a federal agency. You know, it wouldn't surprise me at all. And And just, when I expressed the concerns that we have, she certainly indicated an agreement that those were, from her perspective, things that we should certainly all be looking out for. So, so that's what I, and I wrote out to BioCanRx, the research group, but they have not responded. So, so I don't know anything from them. So I did all those. Well, I met those commitments. I don't know that there was anything else specifically, unless one of you recalls, from the last teleconference that we agreed to do. Christina, do you remember?
No, I think it was covered in the last call. We were just all going to try to connect with our individual medical advisory committees.
Oh, yeah. Thank you. I mentioned that on the first half of the call, so I should mention it, is that we should definitely work through, and Kath's going to send out the letter that we've sent to our SYSF Medical Advisory Committee, connect in with the Medical Advisory Committee and see kind of what their thinking is, whether they'd like to have a meeting with us and to talk about sort of mutual concerns and potential collaborations and so on. And so I think we should all move ahead with that. The other thing we talked about on the first half of the call is the potential for MPPs. We're going to send out a list of MPPs, and I think anybody who can meet at the constituency office with their local MPP would be fantastic. And write to them as well. We're going to draft a letter that people can send to their local MPPs, and yeah, have a discussion about that.
Okay. Great.
So I don't know, I'd love to hear from others if there are other things you think we should undertake at this point.
This is Allison from CCSN. Christine, did you get the opportunity to chat with Canadian Cancer Society? You had mentioned that on the last call as well.
I did. I'm working through some of our connections to try to get this to the right person, but I've not gotten to the right person yet.
Yeah, fair enough.
They just they also just had, as you guys all know, a big upheaval.
Yeah.
Now, I spoke with someone from one of the other stakeholder groups who mentioned, I think it was CPAC. She mentioned to me that she had been speaking with someone from the Canadian Cancer Society, and that they were certainly concerned about it and willing to, interested in doing something, but I don't know who's there anymore. It's terrible to say. So I don't know if any of you are working with them at all and would like to check in with them as to what their thinking is about all of this.
I can ask Gilda, who's away this week for March break, but when she's back, she seems to always follow like who moves where and what, and I can ask her if she, yeah.
Okay, that would be fantastic. Yeah, maybe, it would be wonderful to have them engaged with us on this. I haven't heard. Yeah, so if we can, let's try to do that.
Okay.
Does anybody else have any other great ideas? Even not so great ideas? They could just be average ideas.
This isn't an idea, but I had said I'd report back from the biosimilars working group meeting that was at CCO last Thursday, and there was nothing to tell. So similar, like nobody seems to know anything or be willing to say anything if they do know something, but sort of the same situation that you described.
I really expect that, they're not gonna feel comfortable to say too much. I wouldn't either in their position, frankly. So
there was no blurting. There was no blurting of any kind.
Rats. Oh yeah, no, I don't know how much they actually even know. But even if they do know something, I'm sure they're very discreet at this point.
Yeah.
So,
Louise, it's Rose.
yes.
Yeah, I just wondered before your call on Friday with France Jelena, do you need to prepare anything with the group so you're, ready with questions for her or?
Yeah, actually, I had sent a little note to Christina saying we should probably have a planning call.
Okay, perfect.
Christina, will we be able to do that, do you think?
I hope so, because I think we do need to lay out pros and cons, concerns, and solutions.
Exactly. Yeah. So who do you want to coordinate that? Are you coordinating a call for us, Christina, or should I ask Chantel to do that? But if so,
Oops.
if so, could you let her know who she should include?
Who wants? I mean, everybody on this group could join the planning call. It's more brains than anything. But what's the most efficient way to manage it? I mean, I certainly can. Chantel's probably the best person to send out with the full list. But if it's just us, the people that's around this table right now, then I'm certainly happy to coordinate something.
Yeah, maybe we can even talk about it now and set a time for a call, and then that's done. How many? Who on this call would like to join us for planning?
Before Friday?
Yeah.
Yeah, sometime here. Yeah.
I can try.
So So MJ, yes.
Yeah, I mean, she's really been a huge supporter of our stuff, so I feel like, yeah.
Okay, and Kaylee.
Oh, I'm happy to if it's helpful. Sure.
You bet.
I've also had such great great meetings with France as well. So
yeah, she's wonderful.
Yeah.
I mean, who doesn't, right?
Yeah.
She's just great. Okay, Kathy, will you be able to join us or? I don't know, maybe we lost Kathy.
No, sorry, Louise, I was muted. Yeah, you can go ahead. You can go ahead and add me on.
Okay. And Jamie?
Yeah. We're good.
Okay. Who am I forgetting that's on the call? Nobody, but I could. Okay, so the five of us, and of course Christina as our fearless leader on this one. So when should we? Do people have time on Wednesday or Thursday?
Thursday's better for me.
Okay.
Wednesday, 2 p.m. onward for Wednesday, I'd say, for Kaylee.
Okay. So Thursdays. Everybody have some time on Thursday?
Anytime before.
Yeah, Thursday's good for me too.
Thursday's more difficult for me, unfortunately, but if it's like, it would be like a 3 p.m. is when I'd be available.
How's that work for everybody else? 3 p.m. on Thursday, March 14th for a call.
Yeah,
Mhm.
that's fine.
Yep, that works for me.
Okay, all right. Would you like Chantel to send out a number?
Yeah, that'd be
Great.
wonderful. Thank you.
Yeah, absolutely. Okay.
Could we also, if Chantel's on the line, could Chantel also send it out to Martine? Because she said she was joining us on Friday, so it would be great to have her on the same page.
Okay. Yep, I definitely.
Well,
Okay, so why don't we regroup on Thursday, and at that point we might have a bit of an update, those of us who went to the town hall meeting on tomorrow night, we could give a bit of an update on what we learned there, and if there's been any other developments between now and then, we could do that. Rose, are you going to join us on Thursday? I didn't hear from you.
I'll have to let you know, Louise. I've got a pretty busy day on Thursday, but I'll definitely get back to you. Include me anyway.
I will. Yeah, I'll include you, and you can always opt out. Okay. Okay, so are we, is there anything else at this moment?
No, I'll see you tomorrow, though, Louise. It's Kaylee. I'm going to be going to the town hall as well.
Excellent. And Antonella was on the first half of the call. I believe Antonella's coming. I know Leah Stevenson is coming. I don't know if there's anybody else on the call. Rose, are you going to be able to make it?
No, unfortunately, I can't, Louise. I would love to, but I can't.
Bet. I know. That's all
I've
right.
signed up. I've signed up.
Louise, did you?
So I was just saying I signed up to join, but I have a meeting that finishes at 6, so I may or may not make it in time.
Okay, well, those of us who can will, and we'll be happy to report back anything we learn to the group on Thursday. Okay, well, I really appreciate all of you joining the call, and we'll talk again soon.
Sounds great.
Thank you.
Thank
Bye.
you. Bye.
Thanks, everybody.
Bye.